is Kevin Durandi, CEO of Mahaska Health, and I'm here with Dr. Tim Breon, our Chief Medical Officer. And we want to welcome you to our first ever Women's Health event. And we just appreciate all of you creating awareness for cancer care in our community, and we're thankful for all of you. So I'm going to turn over to Dr. Breon.
Several of our providers have partnered together to provide some video material about women's health that can be useful for this virtual event. And so we would love for you to log on and see that. You can do that on the Facebook page. You can do that on the mahaskahealth.org site. And also for the week of October 19 to 23, that'll be available all week on MCG.
We also want to thank our caregivers. So Sandy, Jesse, and Sally, just appreciate those nurses in the Cancer Care and Infusion Center just delivering compassionate care. We also want to thank Dr. Brad Hyatt, who is a medical oncologist with Mission Cancer Blood, and appreciate that care team taking care of our cancer patients. And so thank you again for creating awareness. Appreciate all of you tuning in, and just appreciate the awareness and support that you provide for families and caregivers and in support of cancer care.
We also want to thank you, just as our patients, for trusting us for your care. We know that you have other options for care, but we also appreciate the opportunity that we have to provide women's health care for you when you choose to use us. So we just once again want to thank you for trusting us with your care. We're doing all we can to meet all of your health needs now and in the future. Thank you.
Thank you, Kevin and Dr. Breon, for that introduction. Mahaska Health is excited to introduce one of our visiting specialists, Dr. Hyatt. Dr. Hyatt has been providing oncology services for our patients for several years. Please welcome Dr. Hyatt.
I'm Jessie Nanikoven. I've been at the hospital for 20 years. The first 5 years were on inpatient, and then the last 15 down in the infusion center.
I'm Sandy Long. I am also a registered nurse and have been employed at Mahaska Health for 15 years. And I've been a nurse for 25.
I'm Sally Blake, and I've been a registered nurse for 27 years, and I've been at Mahaska Health for 18 years. And together, the three of us make up the Cancer Care Infusion team.
I think the three of us talk a lot about how cancer patients, and not any of our patients, make us appreciate things a little bit more. Not maybe take things as granted, the small things.
I think that they've taught us also that the important things in life are really family and loved ones, humor and faith. And if you have those three things, that you weather the storm a lot better.
I can feel like when our patients come in to see us, I want to treat them like I would want to be treated like their family. They come in, whether it's for oncology appointment or it's just the first time coming to the infusion center for whatever you're getting done. You're uneasy about that, and we try to make everybody feel comfortable coming in and soothe their scared feelings that they're having for the first time or whatever it might be.
I think we really get to know our patients really well. Like up on the floor, you're in and out, and you don't have a lot of time to spend usually with patients. But in the infusion center, we really try to schedule patients time that we can sit down and talk to them about their questions or concerns.
We have a little plaque on our wall, and it's kind of at the front. When they first come in, it says, enter as strangers and leave as friends. We get to know our families, we get to know them. Mm-hmm. And people that come to the infusion center, it's not just oncology stuff. It is healthcare, keep people healthy, is osteoporosis medications we give, blood transfusions, outpatient antibiotic infusions, hormone injections. We do all kinds of things to promote women's health, men's health. Sometimes people don't realize what all we do for Remicade infusions for people with Crohn's or MS drugs that a person might need.
Autoimmune system diseases.
Yeah, autoimmune.
We have patients that have been in the hospital with antibiotics and they need to get discharged, and they come in every day for infusions, and just to keep them out of the hospital, we bring them in and give them service. And some people have stuff you have to give a whole year long, every other day, and just to help them get by. And we appreciate seeing them, and I know they like to hear our stories, and you can be silly and human, and
We like to have some fun.
yeah.
We love what we do, and we love the people that we work with. I think also we've all come from different walks of life. We've all nursed in different places. I've had 2 parents that both had cancer. My mom died at 64. So I kind of feel like I can relate with the patients as a caregiver, not necessarily the patient. But there's a lot with the caregiver that it's kind of the silent person that people don't see. It's the person that is behind the scenes and may be exhausted or overwhelmed. And so I think we also try to help the caregiver. We try to give them a break or give them some resources. And maybe sometimes it's just a half an hour away, just to go get some time by themselves. Yeah, that we've got this, and they know that we've got this, and
We'll call up when you do.
and we'll love on them.
One of the best things I love about working for Mahaska Health are my 2 girlfriends right here. Now they're my girlfriends, not just coworkers. Jesse and Sally, we have been together, like she said, for 13 years working
Pretty much
together.
inseparable.
Yeah.
So
We've raised children together. We've been through marriages together. We've been through big times and low times.
But
and
you know, as far as working with somebody, and when 5 days a week for 13 years and you're working with people, it's amazing on the bond that we have created. And that just trickles down to how we care for our patients, how we pitch hit for each other. It's always been important for us to make our kids and grandkids activities, and again,
count on
take
each
care of our patients at the same time, and enjoying working at Mahaska Health. And we just have the best time together, and I think that reflects down to our patients and taking care of them, and our other departments that we collaborate with. You know who you can call, you know who you can depend on, things are going to get done. And but I would have to say my girlfriends are one of the best things about coming to work and me having a good day.
we have each other's back, and we have security in the knowledge that we know each other and how they do things, and how we're going to take care of the patient. You know, it's a solid team, and we love working with each other, and we love our patients. We love what we do. One of the services that we provide is working with Dr. Hyatt's team and with the oncology patients. And we've done that every Thursday for as long as he's been here.
We will have follow-up care. We will do injections for patients that maybe their white cell count has dropped, or their blood cell count has dropped and they need to have injections. Some people that if they've had a rough chemotherapy infusion for some reason, we will do hydration therapy, maybe get some antiemetic or some nausea medications in an IV to help them get through that. Blood transfusions often we could do. Some patients that they have an infuser port, so they get labs drawn from their port, maybe before or after oncology clinic.
My name is Brad Hyatt. I'm a practicing oncologist, medical oncologist. I work with Mission Oncology out of Des Moines, Iowa. So I'm originally a Des Moines native, and I did my undergraduate in Iowa, and then I went to medical school at Des Moines University, and then I did my residency at Iowa Methodist Medical Center, University of Iowa, internal medicine. And while I was there, I had the opportunity to work with some additional oncologists, and I found that I liked working with sick people with problems, where I felt like I could help the most. And so when the time came, I narrowed it down to oncology. And it's been an extremely rewarding experience for me. So, you know, I would say the course I took there, or the things that led me into medical oncology were really multiple factors. It wasn't one specific thing. You know, when I was younger, I had family members that suffered from cancer, and so, you know, as a family member, I went through that. And then as I got older and got into college, you know, I decided to go to medical school, and then I had some professors that kind of pushed me a little bit that way to look into that field. I always really enjoyed reading about oncology and about blood disorders when I was in medical school, and then you get to do rotations, so you get some experience firsthand. You meet the patients and you work with the oncologist, and so I got a chance to do that, and I actually got a chance as a student to work a little bit with one of my senior partners in my group now.
and he's a very dynamic individual, and so that was a wonderful experience. What makes me most passionate about my field or my career is the fact that I get to make a difference every day. I think that regardless of the circumstances, I get to develop a relationship with my patients and work with them throughout their journey. And I think that's incredibly rewarding to be able to help people. For me, the most rewarding part of being a medical oncologist is the working with the patients. It's an incredibly rewarding group of people that I get to work with every day. To help them along their journey. It gives me opportunity to help people no matter what they're going through. So I've had, been fortunate enough to have a number of meaningful experiences throughout my career, and I'd say every day it's meaningful, but I think some that stick out is, always the win, So I think thinking of individuals I've had where we've met for the first time, and the reality is that they have stage 4 cancer, and by definition, stage 4 cancer is typically not curable. On occasion, whether it's divine intervention or not, we luck out, and those individuals are cured. So I think those are extremely impactful and rewarding, and also just the people along their journeys who are able to live with a stage 4 cancer for sometimes decades, and the time that they're able to spend with family members and friends. So I do see a lot of emerging trends in my field, specifically with breast cancer and generally cancer in general. The trend right now is toward treating cancers based on the biology of the cancer rather than just on the stage. And so, for example, instead of grouping a number of individuals together based on how advanced their disease is, what it does is it individualizes that treatment. And so it looks at the particular cancer, because we all have known people that have had the same cancer, and one person does very well and one person may not do so well. And you say, what's the difference? And it's really based on how that tumor acts, not necessarily the stage. And so research is headed toward targeted therapy, and we have a number of very good targeted therapies which allows us to get a better outcome with much less toxicity. So I see the future, that research and those advancements are going to be used for better outcomes. We're going to be able to turn incurable cancer into chronic illness. People are going to live longer, they're going to live better, the cure rates are going to go up. And we're also going to use that information for diagnostics and for tracking recurrence, so that we can catch a recurrence much earlier, which will lead to a better outcome. And I think the other thing that is expanding rapidly is genetic testing. So, the main example of that is on TV, where you see all of these different types of gene tests where you can send in and have your family genome tested, and you can find out who your ancestors are. So it's different than that, but it's similar in a lot of ways, where we can test for particular gene mutations within each individual, and that data is being tracked worldwide. And so over time, scientists are able to constantly discover new genes or mutations that will predict for us a risk of cancer in individuals. So that can be used to be proactive in individuals, so they know, okay, I'm at a higher risk for a particular type of cancer. In this case, we're talking about, breast cancer, ovarian, those syndromes. So individuals can be proactive. A message for current or future patients are that, that we are here, the team is here to help you. We're here to get you through whatever your day brings, and whatever treatments or follow-ups or symptoms you deal with. And I think we're here to to bring you the most current therapy, close to home, so that it's convenient for you and your family. So I tend to have too many hobbies and interests outside of work, which gets me into trouble. No, I enjoy. My latest hobby has been triathlons, so I really enjoy triathlons. I like being outside and riding the bike and swimming, and though I'm not that good at it, I like running. It gives me a nice time to unwind and spend some time with some of my buddies. And I love sailing. That's a passion I picked up from my father-in-law and my wife. And I spend a lot of time with my family, doing things with my family, my kids, and with church. One of the advantages of participating in outreach clinics and places like Oskaloosa, one of the benefits of coming down here is that we're able to provide cutting-edge therapy right here in your own community at Mahaska Health.
Thank you, Dr. Hyatt, for sharing your expertise and perspective on the emerging trends of breast cancer. Next is our very own Leah Rice and Renee Edgar to speak to you about heart health and eating healthy.
Hello, my name is Renee Edgar. I run the cardiac rehab program here at Mahaska Health. I'm very passionate about what I do daily, mostly because I like to talk to the aging adult about healthy habits.
Hello, I'm Leah Rice. I'm a registered dietitian and certified diabetes educator here at Mahaska Health. I'm passionate about what I do because I love helping people meet their health goals. So living a healthy life is really important in managing chronic health conditions and in prevention of certain diseases.
Preventative care, I feel, is the essence at really getting at the core of looking at those major diseases, specifically heart disease. Heart disease has so many factors, secondary risk factors, that preventative care can really look at.
So some habits that can lead to an unhealthy lifestyle would be, like Renee said earlier, failure to plan, having a really good plan for good nutrition. What I see most women struggle with is fad diets. If a diet sounds too good to be true, it probably is. If it eliminates an entire food group, that's a good red flag that this isn't a healthy, well-balanced diet for you that's gonna help you meet your nutrition goals.
One of the mistakes I see someone do, and my patients will tell you notoriously that I say this often, is set yourself up for success. So an easy mistake is not planning ahead. Sometimes just that little bit of help when you get home from work or when you're starting an exercise program or food program, as Leah talks about frequently, is planning. If it's just as simple as setting out your shoes on the end of the treadmill with a change of clothes, so all you have to do is walk in the door and get that completed, then truly that's all someone needs just to get started.
So some things that I think can help individuals manage their diseases is it can be really overwhelming when you're dealing with several chronic health conditions or even with just a brand new diagnosis. So picking one small goal and focusing on that. So it could be as simple as I'm gonna stop drinking regular soda, or I'm gonna start walking for 10 minutes every day. So pick one small goal, focus on that, meet that goal, and then build on that healthy behavior. When you try to take on the whole big picture, it can just feel really overwhelming. And that's something we can help you with. So don't feel like you're alone in that. You have a team.
The best thing I see when people are managing their diseases is I like to really emphasize communication. Communication with their physician, with a family member, someone who can help them manage their disease, and education. Do your best to educate yourself on the disease, whether it be through your doctor, literature, what best fits you personally as far as being able to comprehend that disease itself. A lot of things I hear a patient will talk about when they come in on a daily basis is that female will talk about how they've spent so much time with caregiving for another family member. They've taken care of that family member for so long, they are now seeing me with that heart disease because they let that go. One of the major things, and I know Leah would agree with this, is please keep your healthcare appointments. If you are needing to put yourself to the side, I just spoke to a patient yesterday about how They were nervous about going to the physician. Nervous because they didn't want to have a good, they were afraid of a bad result. They were afraid and anxious, as so many patients are, to go to the physician. But what I try to express a lot, what if they give you good information? What if they put you at ease? So keep your healthcare appointments, eat well, stay active, and sleep. Sleep is a whole nother world of concern for some, but definitely on the top of a priority of taking care of yourself.
I find a lot of the women that I work with are often busy taking care of their kids, their parents, whatever that might look like. And I think it's really important as women to take time for ourselves. So, like Renee said, keeping those appointments, finding time to do something that's relaxing to you, whether it's a crossword puzzle or knitting or walking or, talking on the phone to a girlfriend or a family member, just really carving out that time for yourself so that you can feel energized enough to be there for your family the way that you want to be. So some of the successes I've seen with some of my patients, I like to talk about successes, but I think success looks different for everybody. So like I said earlier, it could be that you were drinking 20 cans of soda a day and now you're drinking 5. That's a success and I want to celebrate that. It could be that you lost 85 pounds. That's a success. We want to celebrate that. But while we're working on getting to the big goals, I want to take time to celebrate the small wins that we have along the way.
I cannot begin to tell you how happy I am when I'm coming and going from work or the grocery store here locally, and I see one of my patients walking. In this great weather that we've been having, nothing has made me happier. And I think about when I see one of my patients walking on the street, and I couldn't begin to count on one hand how many I've seen over the years continually out and being active. You see them at the grocery store and they're approaching you and they're telling you about their continued successes and what they're doing now. And Leah's right, not all success is measured the same, but to them, they're happy. It's what's working for them.
So something I'd like to tell my current patients and my future patients, one of the things I love most about working at Mahaska Health is it really is a team environment. And we want to help you manage your chronic health conditions, and we want to help you figure out a good preventative health plan. So we have a diabetes education program, we offer nutrition education, we offer weight loss education. Renee has a cardiac rehab program. So we have a lot of great opportunities in our community for you to get the help that you need to reach your healthcare goals.
Now we're excited to hear from Jana Galbraith and Renee Edgar on how blood pressure affects each and every one of us.
Hi, my name is Renee Edgar. Today, I'm happy to introduce Jana Galbraith. She's a nurse practitioner here at Mahaska Health. Jana has a passion for cardiac care. I have a few questions for you today. Not to put you on the spot, but I get a lot of questions about blood pressure cuffs at home and the use regarding arm and cuff. What are your thoughts about that?
Well, good morning. Thanks for having me. That's a great question. And I think, first off, if you're checking your blood pressure at home, it doesn't matter how you're checking it. It's most important that you're checking it and that you're being consistent and recording your results so that we have an idea of what your blood pressure is at home. But if I had to have a choice, I think a well-fitting arm cuff tends to be the most accurate for blood pressure measurements. However, whatever is most accessible and affordable for you, as long as you're using the same thing consistently, is acceptable.
Great. So we've talked about blood pressure cuffs. In reality, we're gonna hit this topic of high blood pressure. It is a national issue. People with hypertension and starting on blood pressure medications. So at what age do you feel high blood pressure starts?
That's a really great question. And the thing about high blood pressure is it's asymptomatic and it can occur at any age. Oftentimes people think of it as an older person disease. And we know that that's not true. A lot of times it exists years before it actually causes problems or is diagnosed with your healthcare provider.
So you've seen a patient. They've been diagnosed with high blood pressure, maybe years, maybe it's a new diagnosis. You've started them on a blood pressure medication. Mm-hmm. I hear continuously, okay, so when can I stop this? And When am I on this only for a couple months? Am I on this for a year? I'm assuming you hear that also. What's your thoughts on that?
You know, our goal always is to not prescribe medications if we don't have to, right? And so part of that is there's things that you can do at home to help with blood pressure, limiting your sodium intake, increasing your physical activity, being mindful of where your weight is, you know, what you're eating, their stress level and alcohol intake. And those are really the things that we focus on in the beginning, before medication. And so if we have to use medication, we still want to make that a priority. And as those things change over time, sometimes you can get off of blood pressure medicines as you make lifestyle changes over time.
So it's common to change dosage also.
Absolutely. Yep.
Good.
And you know, we really want to try to use the lowest amount of medication that we can that's effective for you and keeping you safe, but that we're also really focusing on what we can do that isn't medication to promote overall health.
An imperative that a patient talk to you about symptoms, how they're feeling on the new blood pressure medicine also. Good. What about prevention? If you had one key thing that your thoughts on just prevention of high blood pressure, what are your thoughts on that?
Yeah, I love that question, right? Because there's so much that we can do at home. There's so much we can do that happens outside of these walls. And I find that sometimes patients hear everything they can do and take on, you get overwhelmed. It's a lot of information. And I think remembering that prevention is about a journey for health and wellness. You don't have to do all the things right all the time, but if we're making our best effort most of the time, then we're actually making more progress than trying and stopping and going back and forth. So that just to remind yourself, if you're making an effort for your health and wellness, then you really should give yourself a pat on the back, right? Because that's what it's about. It's about a journey over time that we're trying to just promote overall health and wellness. And that's really where you get the most effect in blood pressure and coronary health.
Sure. As you see, Janet has a great knowledge in this cardiac care, just like the rest of our providers here at Mahaska Health. Any questions or concerns, please relate that to your primary care. The phone number at Mahaska Health is 672-3360. So please contact your provider should you have any blood pressure issues or concerns. Thank you.
Thank you.
Jana and Renee did a great job explaining why it's so important to get your blood pressure checked with your provider. Next, we turn to our radiology department to see what it's like to get a mammogram at Mahaska Health.
Good morning. Welcome to Mahaska Health Radiology. We'd like to give you a chance to see what having a mammogram would look like.
Good morning. We'll get you right this way and go over some paperwork and some questions. Right in here. So Grace, we've already went over your patient history and some questions pertaining to risk of breast cancer. So now I'll just explain what we're going to do with the machine so you know what to expect, okay? So this is our 3D mammogram machine. We're going to do a series of 4 pictures. We're going to do a top to bottom picture of each side and a side to side picture of each side. There is going to be a compression during each of those images. It is a firm compression. However, with our 3D machine, it is a lot less compression than it used to be previously. It's only about 1/3 of the compression that we used to use. That's a typical concern for a lot of patients. Is this going to hurt? So I can reassure you that this is less pressure than models in the past. So after we do those 4 pictures, then I will have you get changed and then we'll go over how you're going to get your results, okay? So this is that part that I was explaining to you. We're going to do those 4 pictures. The first 2 sets of pictures we'll do is a top to bottom. Now, the main difference with the 3D machine is the 3D machine is going to rotate. So once I get you into position, it will take 1 picture and then this part of the machine is going to rotate down and it takes pictures in millimeter increments and arcs around the breast. So big face shield here just ensures that your face is out of the way so that it doesn't get in contact with you during the images. So I will just go ahead and get started here. Now, Grace, what I'm gonna have you do is take this arm, reach right up and grab that handle. Perfect. This is where we'll get you into position and then we'll start those images, okay? Okay, Grace, so we finished those first sets of pictures. The second set of pictures is going to be those side-to-side ones that I was explaining to you. So pretty much the same concept. What I'm going to have you do, I'm going to untuck your arm here. I'm going to have you reach up and grab this handle here, and this is going to rotate. And then I'm just gonna angle you a little bit. All right, and then Grace, we're gonna get set up for those images, okay? All right, Grace, so we finished up your images. So what will happen from now is I will finish those up. I will send those off to the radiologist. He'll take a look at it. If there's anything we need to have further from you, any extra pictures or a follow-up ultrasound, then I will contact you by phone. If there's nothing else we need, then I will mail your results out to you at your home address. And your physician will follow up with you as you discussed.
Now that you've seen what a mammogram looks like at Mahaska Health, we thought we'd cover a couple of the concerns that a lot of our patients have.
One of the main concerns that our patients typically have is they would like to know about the dose of radiation with 3D mammogram versus 2D digital mammogram.
The dose for a 3D mammogram does have a slightly increased radiation dose compared to a 2D mammogram. The benefits of the 3D is that we get a much higher resolution picture. It's like looking at pages through a book, that you can page through those tissues and see something much smaller, much sooner by using the 3D. It is roughly twice the dose of a regular mammogram. However, the mammogram itself is less than a month's background radiation. So us walking around in the community over a month's time, just being outside, is going to give us roughly the same amount of radiation that having a mammogram would, even with the 3D technology. And we've partnered with a vendor who is very dose conscious to stay at the top of that level and being as little radiation dose as possible to obtain those images. The benefits of trying to see those cancers sooner with that 3D technology far outweigh the risks of that tiny increase in radiation dose for most women. We do offer it as a choice. We can still provide 2D mammography if a person has that desire.
Another commonly asked question is, what are the screening recommendations? How often should I have my mammogram done?
As an imaging department, we follow the American College of Radiology recommendations. Currently, that means that for a woman with an average risk, we would start mammograms at the age of 40 and do one annually once a year for as long as that woman remains in good health. So that's the other typical concern is for how long when I do those mammograms. It depends really on that woman's health. If there's a lot of other risk factors, a lot of other health concerns, then the benefits of continuing mammography might tail off. So there might be a top cap for that person. That's why screening question is really a perfect discussion between a woman and her provider. Together, they're going to know what the family risk factors are. If there's any other factors that might have a person start screening before the age of 40 or more often or less frequent. It's a wonderful discussion to have with your provider to help make those decisions. As a guiding body, we follow that American College of Radiology recommendation annually for as long as a woman remains in good health, beginning at the age of 40.
Another concern might be, how do I schedule a mammogram? Who do I contact or who do I speak to?
This is that time to have that great discussion with your provider. Together, you'll decide the level of screening that is right for you, and together they can help schedule you that appointment at your convenience here at Mahaska Health. We also have funding available should you not have the funds to cover a mammogram or not have insurance. We do have that funding available, so please don't let cost be a barrier. Please discuss that with a provider. We're happy to hook up that funding behind that very necessary screening procedure for you. Thank you for sparing time for us here today. We look forward to serving you here at Mahaska Health.
Thanks, Julie and Andy. Coming up now, we are looking forward to hearing from one of our own primary care providers and the Mahaska Health physical therapy team on the topic of bladder control.
My name is Lauren Terpstra. I am a licensed doctor of physical therapy, and I have been a therapist here at Mahaska Health for 12 years. I have specialties in women's health and lymphedema, as well as seeing orthopedic and neurological conditions.
My name is Tanya Johannes. I'm a nurse practitioner here at Mahaska Health. I work in the family practice clinic and I've been practicing there since 2016, so it'll be 5 years coming up this January. I see several patients of all dynamics and most recently focusing on a lot more continence issues.
Problems with the pelvic floor can happen at any age. Sometimes it is because the pelvic floor is not strong enough and it needs to be strengthened. And other times it's because the pelvic floor is actually holding too much tension, so you're not able to relax to urinate or to have intercourse pain-free. Seeing a pelvic floor PT for the first time can be nerve-wracking. I am specifically trained to make you feel very comfortable throughout the entire evaluation and helping you improve your overall quality of movement. A pelvic floor PT will do an in-depth review of your health history, as well as a complete evaluation watching how you move, how your muscles are working, and what your joints are doing. Then, if you are comfortable, we will do a brief and painless internal examination to get a further idea of what your internal musculature is doing to better assess your condition. After the evaluation, I will consult with you about treatment plans and different treatment options that would help to improve your condition. Some possible treatments that you may receive are education about the bladder and the pelvic floor muscles, retraining of the bladder, retraining of the muscles to improve coordination. So if you have weakness, working on strengthening, and if you have tension or tightness, working on relaxing those muscles. We can also do biofeedback, in which the PT will place electrodes around the pelvic floor, which sends a signal to a monitor so that the patient can see how well their pelvic floor is relaxing and contracting. This helps to give patients a better idea of what their pelvic floor is doing to help retrain them. Success comes in many forms. I have had patients that have struggled with incontinence for several years, have had bladder surgeries before, and have had to limit all of their physical activity because of incontinence. Following 4 to 6 weeks of therapy, those patients are able to make it through the night without having to get up to urinate several times, be able to go grocery shopping without having to wear a pad, be able to return to walking for activity without having to wear a pad and without leakage. If you feel that you would benefit from physical therapy, speak to your primary care provider about getting a referral.
So currently working in family practice, I see multiple patients with bladder control issues already. So we saw that this was a need to develop an actual continence clinic. So in conjunction with working with Karin Augustine and myself, we want to develop this 1 day a week to better serve the community. And as a partner in the continence clinic, I have Karin Augustine that will be working with me.
My name is Karin Augustine, and I'm a registered nurse at Mahaska Health. Recently, I've taken on a new role as wound ostomy and continence nurse. And that role I started in January of 2020, and I recently finished clinical and the classes, so now I will be board eligible this fall. In July, I completed my continence clinicals. I followed a nurse practitioner, and I could see the positive outcomes that the patients experience from this continence clinic. I feel that this service will be beneficial to our community and the surrounding area to help patients with continence issues. Incontinence is never normal, and there are treatments that are available.
So additional treatment options outside of pelvic floor training include pessaries, there's acupuncture, there's bladder schedules and just retraining the bladder. There's bladder scanning that we can do to kind of see what type of bladder issues are involved, and there are medications, but each treatment option is going to depend on each individual. So for current or future patients, I think the major message would be that incontinence is not normal and that there are different options out there for everybody. So we'd be happy to see you, so make sure that you visit us and we'll see what we can do to help.
Lauren, Tanya, and Karin did a fabulous job explaining how women can take steps forward in therapies to help with bladder control. Next up, we are excited to take a step into the OR with Dr. Brian and his PA, Rachel, to discuss surgical services.
Hello, I'm Dr. Tim Brian. I'm a general surgeon and also Chief Medical Officer here at Mahaska Health.
Hi, my name is Rachel Sheets, and I'm a general surgery physician assistant here at Mahaska Health.
General surgery is kind of an all-encompassing career opportunity. It's great to excite medical students about the things that we get to do on a daily basis. I think sometimes it keeps me grounded and appreciative of the things that we get to do on a daily basis, which is listen to people, listen to them talk about issues that they have that could have a surgical issue. And then when we discuss that with patients and examine the patients and develop a relationship with them, a pretty deep relationship in a pretty short order, then we can develop a level of trust, take them to surgery if they need surgery, perform some specialized procedures that can take care of those issues, and then afterwards watch them get better.
I would say I'm passionate about this field because of the relationships that you get to establish with patients. You really get to teach them about whether it's a new diagnosis or a continuing diagnosis, something that they just don't fully understand. And so to be able to give them the opportunity to ask any question, be there for them, truly listen to them in their scenarios or their stories, and just help them out in the best way that we have to offer.
From a surgical perspective, we try to offer most surgical services that we have the resources to do. And so as a general rule, we typically do everything except for heart surgery, brain surgery, and lung surgery. So about anything else, except for vascular surgery as well, we try to do and provide those services as we're able to. So we do endocrine surgery, GI surgery, surgery on the reproductive organs. We do soft tissue surgery, we do breast cancer surgery, and specifically for women's health, once again, breast cancer, surgery on the reproductive organs, so hysterectomies, ovary surgeries, surgeries for prolapsing organs, surgeries for urinary incontinence, and then also gastrointestinal surgeries that are common for men and women, but those are things that we do using specialized techniques to make the recoveries a lot quicker.
Yeah, and I would add that, with that, a lot of those procedures can be done robotically so that they're minimally invasive and our patients tend to recover really quickly and a little bit easier than they would if it were an open procedure. So some of the other services that we have to provide are obstetric and gynecological, such as cesarean sections. We do tubal ligations, different sterilization techniques, or DNCs.
As surgeons, we try to get people in a position where they understand some of the choices that they may make on a daily basis may contribute to surgical illness and may complicate surgical diseases and even complicate the surgical procedures that we use to repair those surgical diseases. And so allowing people to understand from a public health perspective how healthy lifestyles can help with surgical diseases, can sometimes even prevent those. And also, if we do have to operate on patients that have surgical illnesses, then some of the other emerging trends and things that we practice are certainly minimally invasive surgery, which we've already talked about. We have the robot right behind us, so that's something that we utilize to help with minimally invasive procedures. And not only does it help patients recover from large surgical procedures, they recover quickly, but also it keeps them from coming back with complications that we might have seen from more invasive procedures. So smaller incisions, less chances of postoperative hernias, less chances of postoperative bowel obstructions. And so we don't see those patients that have had large procedures done with minimally invasive techniques returning to the hospital again and again with bowel obstructions, hernia needs for hernia repairs, something that was more commonplace with open invasive techniques. So some of the emerging things. And then also, I think certainly we talk more about genetic counseling and genetic predisposition to diseases, and that's something that's really emerging. Certainly tertiary care centers are areas that are pursuing those things more, but we have to be aware of those trends because it does dictate some of the care that we give patients, not just during their care, but even after care, so they can know whether they have genetic predispositions to certain types of breast cancer or ovarian cancer, and then knowing whether they have those predispositions built into their genetic code that might be handed down to their own children. And so that's something that our patients are more increasingly aware of and want more information about.
So we also have some upcoming trends here at the hospital. We have a lot of new providers that we're going to be welcoming here, both currently and in the near future. They're going to be participating in women's health care, even ranging from pediatrics all the way up until adults. So we're excited about that as well.
You know, I think we want our patients to understand that we're not so much interested in a procedure, we're interested in a patient, and we're interested in taking care of the entire patient. And then I think something else that I would add would be just the fact that the trust that we have in the team that we work with. And I think sometimes people may wonder what the experience is going to be like, and so that makes them kind of nervous. And so I know just sometimes sitting down and walking them through what to expect the day that they show up, you know, the people that are going to be seeing them and taking care of them, ensuring that those people are going to be concerned about their care as well, concerned about the aspects of their care that they take care of. And so I think when they hear us talk about that and when they see that play out, it's almost like they expect things to go a certain way and they typically do, and that just continues to build the trust that they're already establishing with us. So I think, take the time to make it personal up front with them when we see them in the office with a specific concern, introducing them to the opportunities that they're going to have during the day that they're here, and then seeing those things play out in a way that's almost predictable for them, and letting them know that the team that we work with is the same team that we work with almost every day.
I would say that ways we can reassure patients who are concerned or fearful of what's to come with their surgical procedure that they're about to undergo is just to first listen to them, listen to any of their questions that they may have, things that may be misunderstood, and then as a provider, try to relay that information in a way that they can fully understand, comprehend, just make them feel entirely comfortable with what they're about to go through and experience. Try to be empathetic with them and just, again, reassure them that they are in the best hands and at the best facility and they will be well taken care of.
So my healthcare philosophy is something that I think I established early on in my training. Have always been very interested in the delivery of healthcare in a rural setting. I've always felt like if you're going to deliver healthcare in a smaller community or in a rural setting, it can't be any different than the care that you would get if you were in a large city, a tertiary care. So that's why we're board certified physicians. We have certifications that are common to surgeons that are going to be working in any facility. So we all get trained the same way. We all have to apply and are eligible for the same certifications that verify that the American College of Surgeons or the American Board of Surgery supports our practice and supports the things that we do because we're doing those in a standardized fashion. So that's kind of basic, but I think even more than that, knowing that I wanted to do those things in a small community setting, I've always had the desire to take care of the entire patient. I've always had the desire to not just see a procedure, but also enjoy the interactions with the patients and enjoy the interactions with their families. And so doing that in a rural healthcare in a smaller community setting really facilitates that. And so philosophically, I would have a hard time seeing somebody that's been pre-diagnosed, just comes to my office or even, doesn't even see me beforehand. I walk in and say, hi, I'm going to do a surgery, does a surgery, and you never see me afterwards. That would be something that I wouldn't enjoy. It just kind of contradicts the way that I want to function and the way that I think that we want to function. And most everybody that's here kind of practices the same way.
Ways that people can promote their own health is to just ensure that they're participating in healthy lifestyle practices, their diet, exercise, keeping up with general wellness exams. If you're of age, you can get your yearly mammogram screenings, your colonoscopy screenings, just keeping up on those things to ensure that all is still well and there's nothing else that would need taken care of or that could potentially advance into something a little more serious. So that's why it's important to always keep in touch with your primary care providers and just stay up to date on those kind of guidelines.
Yeah, and I think other things that we can do, and we encourage people oftentimes because we have people that come in that have lots of side effects of lifestyles that are already maybe in need of some help. So, eating less, eating smaller, more frequent meals, staying active, trying to avoid things that we know can be problematic. So smoking, excess of alcohol, other practices that we know maybe aren't the healthiest, but we can choose to do those and it's okay. We don't slap anybody's hands for doing those things. Certainly, but at the same time, we try to encourage people that they may have more power to control the things that they do with themselves that may have negative impacts on their health than they feel like they really do. So people oftentimes just say, I can't stop drinking soda or I can't quit smoking. And we talk about that. And we talk about how difficult those things really are. But having those discussions with the patient in a way that isn't looking down on them or telling them that they're a bad person for doing things that we think can cause problems, but sharing with them that those are just common things that everybody deals with, but they can be empowered if they so desire to try to stop those things because there is proven benefit in trying to take good care of ourselves. So, every day there's a success story. I think you almost have to have a success story every day. every day when you come to work, there's always somebody that's not doing so well. There's always somebody that's kind of in the middle of the road, and there's always somebody that's doing a little better. And that mix is kind of what keeps you going, because it's really kind of hard sometimes when you've got lots of patients that aren't doing well, and it can wear on you. You just pray for good judgment in the midst of all that, so you're making sound decisions for the patients you're taking care of. I can think of so many positive, some of them almost miraculous outcomes in patients that weren't offered surgery in bigger tertiary care centers and came to our facility almost as a last-ditch effort. And I talked to the team about those patients and told them what we were going to have to do and the challenges that we would be faced with. And as a team, we approached those patients because we were kind of their last chance for hope. And almost in every one of those instances, we've been in that position. And patients have done better than expected, and it makes us feel good. But I've seen that elevate the desire for nurses and for ancillary staff to want to support the things that we do, because they've seen a few of those cases. They've seen several people that come in that people didn't think they were going to do well. And then when we do the things that we're supposed to do, we do the right thing for the patient, and we just stick in with them. And sometimes it's weeks and months of caring for those patients. When they do better, when it's all said and done, everybody feels better. The patient feels better, but the nurses are encouraged, the physical therapists are encouraged, the people in the lab notice those names every day that they come across the lab, and they see the numbers get better. I think sometimes those get to the executive teams and also to the primary care offices, and those patients come back. And everybody feels like we've just done something that we didn't expect to turn out as well as it did. And when you have a few of those, it really does encourage you and keep you going.
And sometimes it can take a lot of time. It can take, a big situation that impacts patients' lives, but even the smallest things sometimes make a world of a difference too. Sometimes just holding their hand, listening to them, crying with them, saying a prayer for them, those can also make huge impacts on patients' lives, and I think that's what makes it really special.
I think some of the best memories I have are just the relationships that I developed with patients. Doing that over time, if I get to see them out in the community, that's a special thing. You have a bond that you wouldn't have any other way, and I think they're cool. And I think it's cool because I see our team do that, but I see Rachel, is able to do that same thing. She gets it, and for those that get it, it's really amazing.
What a great message from Dr. Breon and Rachel. Next up, we'll be taking a look at our birthing center, which is one of the most exciting departments here at Mahaska Health.
Each year at Mahaska Health, we help bring many babies into the world. This video walks you through our clinical areas so you can see it for yourself. Whether it's your first baby or your fifth baby, our labor and delivery team tailors your care to fit your needs and your family's. At Mahaska Health, you will labor, deliver, and recover in the same room in our state-of-the-art setting with your comfort in mind. Our staff is caring, knowledgeable, and will work with you and your physician. We will support you through a seamless labor, delivery, and postpartum experience. Thank you for trusting us. It's a privilege caring for you and your family here at Mahaska Health.
The Birthing Center is such a wonderful place for some of life's most exciting moments. Up next, we turn to Dr. John Gerke on joint replacements available at Mahaska Health.
Hi, my name is John Gerke. I'm an orthopedic surgeon at Mahaska Health. I chose to go into orthopedics because I enjoy working with people and I enjoy working with my hands. And the opportunity to really help people and fix people is really an honor and a pleasure. And so because of that, I ended up in orthopedics. I chose to practice at Mahaska Health because I had the opportunity to work in Des Moines in a large group for 20 years, and it was missing something. I really wanted to be part of the community, and I wanted to be in a position where I could really affect people's lives. Well, I was born in Columbia, Missouri, and I grew up in Missouri. At the University of Missouri, I went to medical school and thereafter did a residency in emergency medicine. So I practiced emergency medicine for a year or two, but found that I really enjoyed the opportunity to work with people in the surgical realm. Because of that, I did an orthopedic residency. And from there, did a fellowship in foot and ankle. After my foot and ankle experience at the Mayo Clinic, I did a sports medicine fellowship and had the opportunity to work with athletes, and also learned a great deal about trauma. So one of my great loves is taking care of folks with significant injuries. And I had the opportunity to do that in Des Moines, but I wanted to bring that to Mahaska. So my experience in Des Moines, I think, was a great one, but I'm finding my experience at Mahaska is even greater. The most rewarding part of being an orthopedic surgeon is having the opportunity to see people get better. And in orthopedics, we're very lucky because many of the people get better quickly, and it doesn't take long. With new methods, less invasive methods, and new hardware, we're really able to get people moving quickly and effectively. That's been very rewarding. My healthcare philosophy is a very conservative one. I utilize surgical techniques only when they're needed. And I think this is to great benefit to the patient. And surgery, as we know, can always be done, but in the elective sense, it doesn't necessarily need to be done right away. I like to get to know the patient. I like to get to know their expectations, and I want them to know my expectations. Mahaska Orthopedic Department offers a full spectrum of care for everybody here at Mahaska. Just the other day, I had the opportunity to take care of a great-grandfather in his mid-90s and a great-grandson who was 6. That's the neat thing. We provide services to the entire spectrum of the population here, and really, I think, do it well. At Mahaska Health, we offer total knee, total shoulder, and total ankle replacements. In addition, we're getting involved in total hip replacements, and so I think we pretty much run the gamut of available shoulder, knee, hip, and ankle arthroplasty. I think for those individuals considering arthroplasty or shoulder or knee or hip replacement or ankle replacement, they can rest assured that the personalized care here will allow us a successful outcome to your procedure and the rehab that follows. Before joint replacement surgery, we typically make sure the patient's a good candidate. And it also involves getting to know the patient, what their expectations are, what their activity levels are, what the risks specifically to their health is for undergoing such a procedure. During surgery, the cases usually last an hour or two, but patients are often in the hospital for a day, perhaps less, perhaps another 2 or 3 days, but it just depends on the individual. Again, all our care is personalized and tailored to the individual. Post-operatively and follow-up in clinic is very closely performed. We see patients on a weekly basis to make sure things are going well for at least 2 to 3 weeks. Beyond that, we can see folks every month or so. But the rehab is very important, and we have an outstanding physical therapy and occupational therapy team here at Mahaska Health who can help you and help us get you through this whole program. The question of joint replacement lifetime often comes up, and replacement lifetime is usually in the 10 to 20 year range. These are mechanical devices, and they do wear out, much like your knee wore out, or your shoulder wore out, or your hip wore out. But with specific rehab, appropriate therapy, we can maximize the longevity of these joints. I think it's important for anybody considering joint replacement surgery to be as healthy and as active as they can be prior to joint replacement surgery. The stronger you go into any replacement, whether it's hip, shoulder, knee, ankle, the stronger you're going to come out. And so that's emphasized in our preoperative evaluations of all these patients who come in. Again, it's very important for the patient to take ownership and to be proud of what they're doing in preparation for their life-changing surgery. I would say that in support of bone and joint health for women in particular, exercise, sunlight, vitamin D, as necessary, whether it's through sunlight or through supplements, is important. Many of us here in Iowa are vitamin D deficient, and that results in low bone densities. And along with inactivity, we really can have a problem. Women can really have a problem with bone density and thickness, resulting in fractures and the need for total joints and so forth. If you look at the number of years of training and experience of all the providers at MHP in the orthopedic bone and joint area, it's dramatic. We have probably close to 100 years of service to the public and in training and so forth. So I think we're well experienced, and I think we pretty much know what the heck we're doing. If there was a message I could give to my patients and to future patients in Mahaska, in the Mahaska County area and Southeast Iowa in general, I would say that you're not going to go wrong coming here. We're going to give you the best care you can possibly get. We're going to give you more personal care. We're going to give you expertise as good as anything you're going to find in the big cities. And it's going to be a lot more personal, and there's going to be a lot more hands-on. I think you'll give us a try. If you give us a try, I think you'll like us. Well, my wife and I raised 6 kids, including 2 adopted kids. And so our kids have been very important. The family's been very important to us. That obviously is there's a lot of time goes into that. We also have a couple of dogs that are now our new kids, since our other kids have flown the coop. But taking care of the dogs is fun. I swim for exercise. I ride my bike for exercise. Can't run anymore because my knees aren't as good as they used to be. But my wife and I enjoy traveling when we can. And overall, we enjoy Oski. We have a great life here and have really enjoyed it over the last year or so. Well, now that you've had an opportunity to meet me, we hope that you give us a call. We have a great team here. I think you'll really enjoy your interaction with us, and we look forward to really working with you. Give our team a call. We'll be happy to help out in any way we can, and I'm sure we'll be able to find an answer for you. If there's anything we can do, give us a call.
Thanks, Dr. Gerke. We would like to hear from one of our new providers, Dr. Ezeburo, on aging well.
Hi, I'm Dr. Stephanie Ezeburo. I am a primary care provider here at Mahaska Health. My specialty is family medicine, and I love working in family medicine because I get to see the spectrum. I get to see newborns, I get to see adolescents, I get to see young ladies, young adults, I get to see elderly, so I get to see everybody. I love that. The healthcare needs that I notice in young women as they walk through different life stages includes for adolescents and young women, getting familiar with the gynecological exam. That's one thing. Initiation of your menstrual cycle and what that means and what the changes you're experiencing with your body at that time. Being comfortable with oneself and how your body's evolving, especially in young women. Sexual health is also a big thing, and choice of contraception. In the 20s, pelvic exams, we're doing pap smears without co-testing, assessing for HPV, which is a virus that can cause cervical cancer, and making sure we treat you appropriately. Again, another thing is contraception. If you're not ready to have a baby, how can we help prevent this at this stage? Or if you are ready to have a baby, how do we give you the most optimal health so that you can have a healthy baby and a healthy mom. When we talk about our 30s and 40s, we're continuing to do these pelvic exams if they're necessary, as well as doing pap smears at this time with co-testing, assessing for HPV. We're also, again, contraception. If you're not ready for a baby, giving you the options that you have available. Or if you are ready for a baby, what can we do for you to help mom and baby be healthy? We also might begin the stages of talking about mammograms depending on your family history, and also just general exams to be able to be comfortable with your body, watching your breast, doing your own breast exams at home, noticing if there are any differences, making sure you pay attention to your cycles. Have you noticed any differences? Making sure you're also pelvic health, and if you've noticed any differences. So when we talk about late 40s to 50s, we're continuing to do this screening, pap smears, with co-testing. There may be an introduction of menopausal symptoms. And at this point, where mammograms are kind of readily encouraged to be screening either 1 or every 2 years. Colonoscopy is another step in this process. And when we get to the 60s, we're continuing to do the pap smears and doing screening exams because we want to reduce your risk of getting cervical cancer. Ultimate recommendation I have for women is to visit with your doctor annually. Find a doctor that you trust, find a doctor that cares for you and genuinely wants to walk with you through your journey of health, and just stay committed. You may not remember, I need a pap smear this year, or I need to do this, or I need to do that, or I'm due for a colonoscopy. That's what your doctor's there for. That's what they've gone to school for, to learn. So just making that annual visit, maybe around your birthday so you always remember, or maybe before Christmas, however you remember, make that annual visit. The one piece of advice that I would give to a woman if she feels like she's struggling in her adolescence with her menstrual cycle, or she's struggling with choosing the perfect contraception for herself, or if she's struggling with menopausal symptoms, is visit with your physician. This is what we're here for. We're here to listen and figure out what treatment options could be best for you. Some of the uncommon things you may experience as you get older, after having a baby, one of the things that you may not be prepared for is that those pelvic muscles may not be as strong as they used to. And those pelvic muscles hold your uterus, hold your bladder, and sometimes you can experience symptoms of incontinence, or you can have a uterine prolapse. So these things are, although uncommon, they still happen. So again, visiting with your physician, discussing your problems, discussing your concerns, so they can come up with a treatment plan that's best for you. As a primary care provider myself, the common things I like to look for when I'm talking to my female patients and that I would like to discuss include, how many times have you been pregnant? How are your menstrual cycles? How long are your menstrual cycles? How short are your menstrual cycles? Are they heavy? Are they light? Are they regular? Are they irregular? I want to know about your past medical health. I want to know about your past pregnancies. I want to know about your surgeries that you've had. So I pretty much want to know everything about you in an effort to do the best I can to take care of you. By definition, menopause is defined as the absence of your menstrual cycle for 12 months. And the median age for this, most women go into menopause at 51 years of age, but there's some women who may fall into it a little bit earlier, or who may fall into it a little bit later, meaning like plus or minus 4 years either way. And how would you know that you're going into menopause? Commonly, menopause for most women is 51. But if you kind of go back 4 years, you may have noticed that maybe you're transitioning into menopause may have included not having regular cycles. Maybe you have a cycle this month, but then you skip for 2 to 3 months, and then you have another cycle. That might be your transitioning into menopause. You may have symptoms such as sleep disturbances, hot, cold flashes, breaking out in sweats, and you feel like the environment is very comfortable, mood changes. For every woman, it's very different. Some ways women can deal with side effects of menopause include exercise. Exercise is really, really good. Eating healthy are some simple, conservative ways you can deal with menopausal symptoms. Another way, if the hot flashes are becoming uncomfortable and you're not being able to work or get through your day, then seeking assistance from your doctor. We have prescribed medications that we can give, such as estrogen replacement. If you fit the criteria for receiving it, you can receive that. You can receive some other medications that may help you be able to better cope with the symptoms associated with menopause. We also have non-hormonal options that have been studied and been seen to might be effective as well that we can discuss. So bottom line, at home, you can do exercise, you can eat healthy, you can move, you can have positive thinking, whatever helps you get through, supportive groups with friends. Number 2, visit your physician. Your physician has an array of options that they can choose from to help you cope with menopause. Okay, women can expect that as they're progressing through the end of menopause that they'll have less mood swings, they'll have less temperature changes or effects of temperature changes. They'll be better able to cope with the symptoms that they're experiencing. And maybe they won't even have any more symptoms anymore as your body just learns to transition through. I just like to tell future patients, current patients, that I'm here to be a part of the process of helping you feel better, and I'm on your team, and you are welcome to come and see me at any time.
Thank you, Dr. Azaburo. Up next, we'll have Dr. McCubbin speaking about potential issues in women's sleep.
My name is Michael McCubbin, MD. I'm the medical director of the sleep lab at Mahaska Health. I wanted to talk today about sleep issues that are common in women. Some of these are in men also, but especially focusing on women's sleep issues. The biggest issue that most people have is not scheduling enough sleep. The average person needs 7.5 to 8 hours of sleep, but most of us average about 6.5 hours. Reasons for this are many: overwork, lots of activity that we have with kids, family, various things. But it's important to have sleep be a priority in your life. If you schedule and get enough sleep, the day goes much better. People are more productive, have less irritability, less accidents at work. All sorts of things are much better when we're widely awake. The most common sleep problem that women have is insomnia. It's very common. Up to 20–30% of women especially will have insomnia at some point in their life. The causes can be many. Some are directly related to unique to women, such as pregnancy and childcare issues. And then in older women, menopause, the hormonal effects, hot flashes, that type of thing can all lead to insomnia. Insomnia is basically a problem getting to sleep or a problem staying asleep. So you can have one or the other or both. The worst is when you have problems getting to sleep and then also wake up frequently. As far as how to approach insomnia, the most important thing is what the underlying cause is. Again, if it's certain medical problems, you have to address the medical issue first. Oftentimes, the knee-jerk response for insomnia is to use a medication, but that actually may, in the long run, make things worse because medications have side effects. The first thing that should be looked at is what your sleep hygiene is. Sleep hygiene is basically just the behavior and habits that we have before going to bed. There's good sleep hygiene and poor sleep hygiene. Some things that interfere with us going to sleep and can contribute to insomnia include using a computer right up to the time of bed, being on a cell phone, either texting or just playing games on a cell phone. All of these things essentially get the mind going, and the light from the computer screen actually keeps us awake. Um, Other simple problems could be eating a large meal before bed, which can interfere with sleep. So changing some simple habits before bedtime can make a big difference. Most people need a half hour to an hour of wind down time before bed. This is time when, again, all the electronics should be turned off, the lights in the house dimmed. If you want to do something, maybe a little bit of reading, essentially getting ready for bed and having that consistent throughout the week. A consistent bedtime is also important. So that will take care of many of the simple insomnia problems. Another common medical problem that leads to insomnia is depression, and depression is a major cause of insomnia. So any evaluation of insomnia should include some review of mood and possible depression. Other medical problems, not directly related to insomnia, but that can contribute to it, is a condition called restless legs or periodic limb movements. These are involuntary movements of the legs, arms, hands, or a very restless feeling. Usually occurs before bed, in the first hour or two before bed. Can be very annoying. A person will feel sort of numbness, tingling in the legs or arms, and this interferes with getting to sleep. Once a person is asleep, these uncomfortable feelings can translate into abnormal leg jerks, which can then wake you up or wake up your bed partner. Restless legs and periodic limb movements is especially common in persons with iron deficiency, and iron deficiency is more common in women compared to men. This also can be a problem during pregnancy, restless legs being a major problem in some women during pregnancy. Aside from iron deficiency and treating that with iron tablets if iron is low, there are other medications that can be used to treat this. Unfortunately, during pregnancy, we like to avoid all medications, so it's something that unfortunately just has to be waited out. When we get into other common medical problems interfering with sleep, the most common would be obstructive sleep apnea. That is a condition that is generally more common in men up until menopause. After menopause, it's equally common in men and women. The main problem with sleep apnea is that the muscles in the back of the throat will relax when you get to sleep. And these muscles, when they relax and you're in deeper sleep, will close down, and then the air basically can't get into the lungs like it should, so a person will essentially stop breathing. Usually loud snoring occurs with this, and then after a person stops breathing for several seconds, they'll sometimes make a big gasp and start breathing again. This can occur over and over throughout the night. Again, it's common in men, especially obese men, but could also occur in women. Is increased during pregnancy, actually, and if not treated, could have problems with the baby, and also is common in women after menopause. Treatment is fairly fairly effective, which consists of first a diagnosis being made with an overnight sleep study, and then treatment with what we call CPAP, continuous positive airway pressure, which is a mask that goes over the nose and mouth, or just the nose, hooked to a little machine that puts a pressure of air into the nose and pressurizes the area between the back of the throat and the tongue and the other muscles, and keeps it from collapsing. With that treatment, the snoring goes away, the pauses in breathing go away, and sleep is much more refreshing. Untreated sleep apnea can lead to increased heart attack, stroke, and just daytime sleepiness and difficulty in performing during the daytime. One final sleep disorder to consider is actually secondary sleep disturbance. If a bed partner has a sleep problem, such as sleep apnea or restless legs or leg movements, those problems can disturb your sleep. It's very common in the sleep clinic for us to see a man who is sent in by his wife because she can't sleep. He's not complaining so much, but she's complaining of his snoring and his movements, and his sleep problem is disturbing her sleep. So partner-induced sleep disturbance is common. The way we approach sleep problems in the sleep clinic is to first obviously interview the patient, get a history of what is going on. If a significant sleep problem such as sleep apnea is suspected, then we would recommend an overnight sleep test. That can either be a home sleep study or a sleep study that's in the sleep lab. The home sleep studies are set up with some equipment which is given to the patient to put on in the evening, and then you push a button and start the recording, and then bring all the equipment back the next day. An overnight sleep study in the sleep lab is a little more complicated, but also much more detailed, in which a person is hooked up to a number of monitors, and we measure breathing, heart rate, oxygen levels, and a variety of other things, and essentially watch the person sleep during the night, and we can diagnose sleep apnea, leg movement problems, seizures, all sorts of sleep disorders. So if anyone feels they have a sleep disorder, or that their partner may have a significant sleep disorder, I encourage you to first discuss it with your primary care provider, and if appropriate, a referral to the sleep clinic or sleep lab can be made, and we can help investigate the problem and overall hopefully help your sleep.
To close on our time this week, we'll hear a few words from our CEO, Kevin DeBronde, and our Chief Medical Officer, Dr. Tim Breon.
Thank you for listening in to the many providers on our Women's Health virtual event.
Yes, thank you. And also want to remind you, if you're interested in scheduling an appointment, Mahaska Health is dedicated to caring for you. So make sure you either log on or give Mahaska Health a call, and we can schedule your next appointment if that's needed. Thank you.